Good morning, everyone. Here's a developmental checklist for 15 months. So it's a Nipissing District Developmental Screening Tool. It's meant for families, childcare providers, and other professionals just to take a time to do a little check if your child's reaching their milestones. If not, it says if you say no to any of the developmental questions or you have concerns about your child's development, follow up with your health care and or child care professional. And for more information, I'll be posting the website as I have before. So last week we did up to 12 months, and now we're by 15 months of age. Does your child use 5 or more words? Words do not have to be clear. So if they use dada, mama, doll for dog, baba maybe for bottle, that's what they're meaning. But there's 5 words that they always use for specific things like mama or dada or baba. Do they look at pictures when you name them? So if you're looking at a picture and you're saying dog, do they look at that picture? Do they try to reach something by making sounds or words while reaching or pointing and looking at you? So are they pointing to something with their finger? Or are they going ba, 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 trying to get your attention? Do they imitate a few animal sounds? So if you go cow, the cow goes moo. Do they moo? They may not say it clearly, but are they attempting to imitate those sounds? Do they connect sounds that seem like little stories? So maybe they go ma, ba, da, ba. So are they connecting sounds together as if they're using words in a sentence? When you call their name, do they respond to it? Do they turn? Do they look at you? Do they pick up and eat finger food? So are they able to feed themselves with their fingers? Do they recognize some body parts on self or dolls? So if you say head, would they tap their head or nose? So not the more difficult ones, but the easy ones. Can they crawl up the stairs? Can they walk sideways holding on to furniture? So they may not yet be walking independently, but can they hold on to furniture and move around? Do they try to squat to pick up toys from the floor? So can they bend over and hold their balance and pick up a toy? Do they remove their socks and try to undo their shoes? Do they stack 2 blocks, one on top of the other? So 1, 2. Can they do 2 blocks? Do they use 2 hands while playing with a toy? So do they manipulate with both their hands, or do they only use one hand? Do they repeat an action that made you laugh? So if they go and you laugh, do they repeat that action because they understand that they're receiving attention, a response for it? Do they look at you to see how to look to you to see how to react? So after falling, do they look at you to see should they start crying? Or when a stranger enters the room, do they look to you to see if that's okay that that person's entered the room? If you've said no to any of these questions, again, consult your pediatrician or your health care provider or a child care professional. I'm going to post a website so that you can go to it. These are developmental milestones for 0 to 6 years of age. And of course, all children develop differently, but these are sort of the minimum of what a child by 15 months should be doing. Some children are more advanced in some areas, but if you have answered no, make sure that you consult with your child care professional, your doctor, your pediatrician. Okay, we'll see you tomorrow. Bye, everyone.